let's talk about whiteheads. First, and most importantly, severe whiteheads aren't a sign that your skin is dirty. In fact, they're the opposite. A whitehead, or closed comedone, is a plug of oil and dead skin cells trapped the surface of the skin. Unlike a blackhead, which is open to the air and oxidizes, a whitehead is completely sealed. This sealed environment is what makes them so prone to inflammation and so tricky to treat. They are essentially tiny, contained infections waiting for a chance to escalate. Our first instinct is often to squeeze, but applying pressure from the sides doesn't just fail to work. It actively causes damage. This lateral force can rupture the follicle wall underneath the skin, spreading bacteria and inflammation. The result? A bigger, angrier pimple, and a high risk of scarring or post-inflammatory hyperpigmentation that can last for months. But tonight, we're changing that. I'm going to teach you the safe, effective, esthetician-approved way to flatten and clear these stubborn spots, fast. Welcome to my WHIT Out Roadmap. This is a systematic, step-by-step method designed to work your skin, not against it. W is for warm and soften, to prepare the skin. H is for hygienic double cleanse, to create a clean slate. I is for identify readiness, to know when to act and when to wait. T is for target and treat, to reduce inflammation and dissolve the plug. E is for extract only when ready, the correct and safe technique. And finally, out, which stands for aftercare, upkeep, and timeline, to ensure rapid healing and prevent recurrence. Let's begin. W, warm and soften. The goal here is not to open your pores. Pores don't have muscles to open and close. Instead, we are using gentle heat to soften the hardened sebum and keratin plug inside the follicle. Take a clean washcloth and run it under warm water. It should feel comfortably warm to the touch, like a bath, not hot. Wring it out and press it gently onto the affected areas, like the jawline, chin, or nose, for 2 to 3 minutes. This simple step makes everything that follows much more effective and less traumatic for the skin. If you wore heavy sunscreen or makeup today, it's crucial to remove that surface layer first. A quick, gentle swipe with a micellar water-soaked cotton pad will do the trick before you start your main cleanse. H, hygienic double cleanse. This 2-step process is non-negotiable for congested skin. First, an oil cleanse. Apply your cleansing oil or balm to skin and massage for a full 60 seconds. This allows the oil to dissolve the hardened sebum, makeup, and SPF. Then, add a little water to emulsify it into a milky texture before rinsing completely. For your second cleanse, choose your cleanser based on your skin's needs. If you're prone to congestion and breakouts, a gel cleanser with a low concentration of salicylic acid is an excellent choice. If your skin is more sensitive or reactive, opt for a gentle, hydrating formula with calming ingredients like heartleaf, centella asiatica, or green tea. Massage this second cleanser for another 60 seconds. After rinsing, your skin should feel clean and soft. Here's a key test. Glide your fingers over your damp skin. They should move smoothly. If you hear a squeaking sound, it's a sign you've over-cleansed and stripped your skin's protective moisture barrier, which can actually lead to more breakouts. Now, pat your skin mostly dry or let it air dry for about 30 seconds. This brief window allows your skin's pH to reset slightly, creating the optimal environment for the targeted treatments we're about to apply. I, identify readiness. This is the most critical step. Not every bump is ready for extraction. We use a traffic light system. Green is go. This is a mature whitehead that is raised, has a visible white tip, and feels soft. It's ready. Yellow is caution. This is a closed bump that's still under the skin, flat or hard. Do not try to pop this. You will only cause damage. This needs topical treatment to bring it to the surface. Red is stop. This is a lesion that is hot, red, painful, and deep. This is a cyst or nodule. Do not attempt any DIY extraction. Your only job is to calm the inflammation. T, target and treat. Now we apply targeted actives. For yellow light and green light zones, a short contact therapy approach is best. Apply a 2.5% benzoyl peroxide wash as a mask just on the breakout zones. Let it sit for 60 to 90 seconds to kill bacteria, then rinse thoroughly. If your skin is sensitive to benzoyl peroxide, a 5 to 10% sulfur mask is a fantastic alternative. Apply a thin film for 5 to 10 minutes, then rinse off. Next, for oil-soluble exfoliation, take a low-strength BHA or salicylic acid between 0.5 and 1%. Dispense a small amount onto your fingertip and gently press, don't rub, it onto the nose, the chin, and the jawline. Pressing ensures targeted delivery without causing unnecessary friction or irritation. To boost this routine, you can incorporate a couple of weekly treatments. 1 to 2 times a week after your second cleanse, use a powder-to-foam enzyme cleanser for about 45 seconds to gently dissolve surface dead skin. You can also add a short contact clay mask on your T-zone. The key is to rinse it off. It fully dries and cracks, which is when it starts to draw moisture from your skin. Extract only when ready. This is for green light whiteheads only. First, hygiene. Wash your hands thoroughly. You can either wrap your index fingers in clean tissue or use a comedone extractor that has been sanitized with rubbing alcohol. Ensure the whitehead and the surrounding skin are completely dry. Slip is your enemy here. Use your non-dominant hand to gently stretch the skin taut. This anchors the follicle and provides a stable surface. If using Q-tips, place them on either side of the whitehead at a 45-degree angle. The motion is crucial. Press gently and first, then roll upwards. This coaxes the contents out from below. If using a loop tool, place the loop so the whitehead is in the center, press down gently, and roll or glide it across the pore with low, even pressure. The goal is to ease the plug out, not force it. And now, the most important rule, the rule of 2s. You get 2 gentle attempts. Maximum. If the plug does not release easily after 2 tries, it is not ready. Forcing it will only lead to inflammation, trauma, and potential scarring. You must stop and accept that it needs more time and topical treatment. Out. Aftercare, upkeep, and timeline. Immediately after a successful extraction, you need to calm the area and keep it clean. Gently swipe the area with a sterile saline solution, the same kind used for contact lenses, and pat it dry. Then, apply a micro dab of salicylic acid spot treatment directly onto the empty pore to keep it clear. To protect the area, promote healing, and absorb any remaining fluid overnight, cover it with a hydrocolloid patch. This creates a moist, clean healing environment. And the next morning, without fail, you must apply a broad-spectrum sunscreen with at least SPF 30. The freshly treated skin is highly vulnerable to UV damage, which can easily cause dark marks to form. Sunscreen is your best defense against post-inflammatory hyperpigmentation. Let's quickly cover some common mistakes. The biggest is squeezing sideways and with dirty fingers, which we've discussed. Another is overwashing or using harsh stripping cleansers in an attempt to dry out the acne, which only damages your skin barrier and worsens the problem. Trying to pop deep, painful cysts is a guaranteed way to get a scar. And finally, going overboard with too many active ingredients at once will only lead to irritation, not clearer skin. Stick to the plan. So there you have it, the WHITE out method. Warm, cleanse, identify, treat, extract safely, and follow up with proper aftercare. By following these steps, you can finally manage whiteheads effectively, reduce their lifespan, and protect your skin from damage. Be patient, be consistent, and be gentle with your skin.